Hi, everybody. Welcome to the third episode of the Kickback. I am here with an amazing person. So here we have Dr. Karli Richards. So she's a podiatric surgeon who practices with UPMC Richards Orthopedic Center and Sports Medicine in, I'm going to pronounce this correctly now. Is it Chambersburg?
Chambersburg.
Chambersburg, there we go.
Yeah.
Pennsylvania, USA. And Dr. Richards has been in practice for over 15 years and specializes in foot and ankle injury, in ankle surgery, sports medicine, general podiatry, and wound care. She's board certified in both foot surgery and in wound care. Dr. Richards is an integral part of her sports medicine practice and treats athletes from local high school and college teams for lower extremity injuries. Richards Orthopedic Center serves as the team doctors for the Shippensburg University football and athletics teams. So, wow. And check this out. In her free time, Dr. Karli serves as the USA ambassador for the Spirit of Football organization and continues to compete in sport as a competitive slalom water skier, recently placing 8th in the USA in her age division at the 2023 USA Water Ski Nationals. That's incredible. And and your husband is also a soccer player and a coach who won a collegiate NCAA title for soccer during his career. And we're so honored to have you here because you love speaking publicly about providing education for injury prevention, specifically for female athletes. And you've been a guest speaker for many organizations, professional teams, and podcasts, including Equal Playing Fields, Equality Summit in London, the IDA Sports Company podcast for the Jordan Women's National Football Team in Jordan with the World Learning and US State Department, Women in Football podcast, and the Athletic Magazine podcast. Wow, I could go on. You've done so much amazing work. So Dr. Karli Richards, thank you so much for joining me today to have a chat about this big problem of ACL injuries.
Absolutely. Thank you for having me. I'm honored to be here. Thank you.
Bless you. So let's get down to the problem, right? So we've got a lot of our listeners out there who have had, like, those big names who have had these ACL injuries but may not actually know what an ACL injury is. So would you mind just explaining a little bit about what exactly is an ACL and about the injury?
Sure. So the ACL, it stands for anterior cruciate ligament, ACL. It attaches your thigh bone, which is your femur, to your shin bone, which is your tibia. So it's a ligament that's inside the knee joint, and it helps to stabilize the knee joint. Now, it's not the only ligament in your knee. There's other ligaments that help to connect the knee, but the ACL is one of the main stabilizers of our knee joint. And when that ligament becomes injured or torn, the knee becomes unstable. You can still walk when you injure the ACL, but the stability is just not there. So it's very difficult to run, to turn, to jump. And that's why this is such a big deal when any athlete injures the ACL ligament.
Oh, wow. Okay. That does sound very important. Now, I pick up on the fact that you say torn, but also, like, is there a difference between tearing it and breaking it? And is there a different way in which you sort of manage it?
So when we talk about breaking something, we're usually speaking about bones. Mm-hmm. With a ligament, a muscle, or a tendon, we talk about tears or ruptures. So with the ACL, that's a ligament. It's very small. A tendon and a muscle is usually bigger, and the ligament connects two different bones together. So it's several small fibers that connect two bones. And when you have a tear of that, then the ligament becomes weak and unstable. And when the ligament completely ruptures, that means it pulls off of the bone. So that's how we define tears and ruptures. But we don't really break our ligaments, but we can break our bones.
That makes sense. That makes sense. Yeah. So obviously, in the world of women's sport, ACL injuries have been massive. And I mean, equally, the men also get ACL injuries.
Correct.
why are we talking more about ACL injuries in women right now? Like, what is happening? Is it's more prevalent in women, isn't it?
It is. So women are usually about 5 to 8 times more likely to tear their ACL than men. So there's been several research studies that have been done that show that women are more likely to have this injury than men. That doesn't mean it doesn't happen to men. It definitely does. It's just more prevalent with female athletes, specifically with football or soccer players. And we'll talk about this as we go on, but there's several factors as to why that's the case. And the other reason why I think it's more prevalent on our minds right now, and we're talking about it more, is the women's game is much more popular now than it's ever been, which is fantastic. But because of that, we're actually seeing these injuries on the big screen, where it's part of our conversation, and it's bringing light to the fact that this is an epidemic in our women football players, these injuries. But it's always been there. Before women's football was popular, women were still getting injured more so than men on the football field. So this isn't anything new. It's just that we're finally talking about it and hopefully going to do something about it, which is a good thing.
Why do you think it's sort of taken so long for us to actually pay attention to the fact that it's affecting women more? And why do you think we're so behind on the research and trying to address the problem?
Well, for a number of things. One, women's sport, it's come a long way in the past few years, but this is all very new worldwide. I mean, even the United States, like Title IX wasn't that long ago when we got equality in our colleges. And more women are starting to play sport, which is good because they have more equal access to sport. Still not as good as it could be, but it's getting better. So I think with more female athletes and women starting to be on the center stage on all different types of playing fields, soccer, basketball, field hockey, it's just more prevalent right now. And we're seeing the injuries more. So that is bringing light to the issue. So I think it's more of an evolution of female sport in the entire world, not just in the United States or in Europe, but everywhere. And the more female athletes we have, the more of a voice they have, which is fantastic. And people want to recognize what they're doing and also help them prevent the injuries and give them equal access to the playing fields and the medical care that they deserve.
Hmm. So it's really interesting that you speak about this, and the one thing that kind of comes to mind is obviously, as you mentioned, we've got the evolution of women's sport and specifically women's football, and I think we've seen a massive growth since the Euros, since the World Cup and everything like that.
Right.
I suppose one of the questions I have is, do you know if there's a really big difference between how men train in football and how women train in football? And do you think the difference in the way that they're trained actually impacts upon the rate in which ACL injuries occur?
So I definitely think it has something to do with it. I think number one is equal access. So we need to make sure that our women athletes have the same opportunity as our men do. They have the good playing fields that the men do. They have access to the physiotherapists and the trainers and the weight rooms and the strength and conditioning coaches. And some places they do, and some places they don't. It depends on really where you are in the world and also where you are in the country, even the United States. Some places it's very good and some places it's very bad. So I still don't think that our women soccer players have equal access to all of those things. Another point is I feel that our women need to be trained differently than men. We're made differently. Our muscles are a little bit different. We have different anatomies, so the strength and conditioning programs need to be different. And that is starting to happen on the very high levels, which is great. The professional levels, the national teams all have very good physiotherapists and strength and conditioning coaches. But when you come down from that, it's not there. With the club levels, the high school levels, and even some of the colleges in the United States, we're still not there. So I do think that does contribute to some of the increased injury rate. I don't think that's all of it, but I do think it's part of it.
So you mentioned that there is a difference between there are physiological differences between men and women, which also predisposes us to having an increased rate of ACL injury. So what exactly are those? How are we built differently?
Oh, we are so different, but it's a good thing. So number one is our anatomy. So our hips are a little bit wider than men because we bear children. So we have anatomically wider hips, and we have what's called a different angle of our Q angle. What we do is we can actually measure an angle from the top of the hip bone to the inside of the knee. And women's Q angle is wider than men's Q angle. The normal Q angle is anywhere between 12 and 20 degrees. Women are closer to 18 to 20 degrees, and men are closer, down to 12 degrees. So with that wider Q angle, it actually causes women to turn in more. So if the hips are wider, then the legs go in more like that. Okay. And that puts more pressure on the inside of the knee. So that in itself, just our anatomy, puts more pressure on that ACL ligament. And then there's another factor, our neuromuscular makeup is a little bit different. So women are what we call quadricep dominant. So our quadricep muscles are on the front of our thigh, and our hamstrings are on the back of our thigh. Men usually have equal strength with their quads and hamstrings. And women usually have a little bit stronger quad than they do hamstring. And what that causes is when a woman athlete comes down from a jump, if they go up for a header, their quadriceps fire more than their hamstrings do, and it causes them to extend their knee. So it puts them into almost a hyperextension when they land, unless they're trained not to do that, or if they're in the proper strength and conditioning program, then that shouldn't happen. But if those quads are firing much stronger than the hamstrings and the knee hyperextends, then that puts more pressure on the ACL ligament. So that's another anatomical difference that can increase the risk of injury. And then a third thing is hormones, and we can get into that later if you want to, but
we can get into it now if you want to.
You want to get into
so
it
interesting.
It is interesting. So that's obviously the main difference between men and women are hormones. And the female menstrual cycle goes through different phases, and during certain phases of that cycle, we can have what's called ligamentous laxity. And that's where the ligaments in our body are a little bit looser. And that's usually during what we call the late follicular phase of our menstrual cycle. It's called late phase 2. And that's after you have your period, but right before ovulation. Okay. And during that time, estrogen levels are increased and progesterone levels are decreased. And with that, you can get a little bit of what we call ligamentous laxity, where the ligaments aren't as tight, they're not quite as stable. And that can lead to instability of the knee complex and increase the risk for ACL injury.
So how long does that time period last, that phase? How long does that phase last?
So that late phase 2, it's usually just about a week or so. It's not very long. It depends on, that's hard to answer because it really depends on the woman, because everyone's cycles are different. So everyone has a different length of their menstrual cycle. The days are different depending on the person. So that's why period tracking is encouraged for female athletes, so you know where you are during the cycle and how to train appropriately during that time, especially for high level athletes.
So so just going from what you said, I'm just kind of thinking, like, is the combination of obviously the strength and conditioning to kind of build your base, learning about how you should be landing and moving, but also potentially not playing or training during that late phase 2 period of time for players, could all of that in combination potentially reduce the incidence?
So I think understanding it all could reduce it. We don't recommend that people stop playing their sport during a certain phase of the menstrual cycle, because that's, first of all, it's not functional. it's not reality. No, most athletes aren't going to do that. So the best thing for an athlete to do is to understand where they are in their cycle and to train appropriately during that time. So during phase 1 and phase 2, with estrogen being higher, people usually have more energy. So this is a good time for strength and conditioning and high intensity workouts. But also during that late phase 2, there should be a longer time of recovery. So if you have a tough match and you're in that phase, you should take 72 hours off after that match so that your muscles and tendons and ligaments can recover. And that's that talking about hormones could be a whole separate lecture in itself, but there are nutrition guidelines for different phases of the menstrual cycle. There are different strength and conditioning recommendations during each phase, how you should be exercising, things of that nature. So, and I do know that with the higher level teams, like the national teams and the professional teams, their strength and conditioning coaches and nutritionists do look at that. So that is being looked at and tracked for professional athletes, and that helps them train appropriately during different phases of their cycle. So it's interesting, and there aren't enough studies out yet. We don't have enough data for me to say, during these 3 days of your cycle, your highest risk for injury, because there have been 1 or 2 studies that do show that, but that's not enough. Like, we have very little data on a lot of these factors, and that's one of the biggest problems with women's sport is, we see the problem, we know it's happening, I can tell you what I think, why it's happening, but I don't have enough data to back it up, and we need more of that.
Yeah, this is the one of the other pet peeves, I suppose, we have, is about kind of sharing the data. So we know that clubs do collect data. We don't know what kind of data, we don't know what kind of player data, we don't know who or how it's stored or how it's used or anything like that. But surely, globally, because football is so massive, surely all of that data could be collated, it could be analyzed, and because if everybody's doing the same thing, right, as you said, on the higher level, on the elite teams, everybody's looking at the phases, the nutrition, the strength and conditioning. Surely people are collecting data on this within their clubs, surely.
Right.
This is what I'm hoping anyway. And
right.
then you gather that globally, you have a team of people who come together, analyze this data, and you've got such a robust, almost like a multi-center trial type of thing happening where you've collected
right.
Surely that would be a logical thing.
And that's what I want to do. I have an idea to do this with some of the factors that I talked about, and it's hard to find. Everyone thinks it's a great idea, but when it comes down to, okay, let's do this, it's hard to find the investors and the players that really will sign up to help, figure this out. So, and I think when you get to that higher level, a lot of the athletes have different contracts, and some of them might agree to participate, some of them don't want to for different reasons, and it's tough. So, but I 100% agree with you. I think that the only way we can make good medical recommendations on how to reduce injury rate for women football players, we need more data, because that's the end of the story. It's like I can tell you what I think, and from an anatomic and neuromuscular standpoint, but I only have 1 or 2 studies for each of these points to back it up.
Yeah,
and none of it together. Like, it all needs to be put together.
Yeah, 100%. We need literature reviews, we need multi-center trials, we need loads and loads of things, to be honest, that need to happen. And you're right, people keep talking about the fact that women's football is $1 billion industry. Like, it has the potential to be $1 billion industry, but what we really need is investment for the longevity of the game. If we don't invest in research, and the bizarre thing is that all the athletes, they're asking for more research. Because what they're asking for it is another thing, investing in it,
right?
People to invest in it, right? And that's, I think, is the biggest point. And we need clubs to come on board with that, ideally, isn't it?
Right. And that's why I got into this over 1.5 years ago. I gave a talk at the Women's Equality Summit in London, and spoke about injury prevention, and I had so many athletes and coaches on the professional level come up to me and say, we didn't know this. We need to do more. We need more research. And so I started to do more speaking engagements and education for players and coaches. And a lot of the education isn't there either, even on a higher level. So I think in addition to the research, we also need to be providing education for players and coaches and physiotherapists. And then, if everyone's excited about the education and they want to do more, but then when it really comes to taking action to do more, it's hard to find the right people who will take the action, will invest in it. So that's kind of where I am right now. It's a bit frustrating, I'm trying to help. And it's hard to find the investors to take it to the next step.
I always say that when you've got good intentions and you've got pure intentions, even though the battle may be frustrating and it's an uphill battle, eventually, because it is a good intention, it will always come to fruition and there will always be success. And I'm calling out the clubs right now, and I'm telling them, we need investment. You want longevity for your clubs, you want sustainability for your clubs. This is what you need to do. Okay, you need to invest in the research. So don't worry, we're gonna make it happen. I am committed to making it happen. I'll tell you that.
I am too. I'm right there with you.
See, every time I talk to people, my head starts buzzing with ideas. We're gonna make this happen.
Yeah.
We'll make it happen. 100% for sure. So how now I've seen here, like, so one of my loads of my favorite footballers have suffered from ACL injury. So Leah Williamson, Beth Mead, Vivian Miedemar, Taya Goldie, and they have it multiple, some of them have had it multiple times as well.
Mm-hmm.
Now, I read that it takes about 9 to 12 months to actually recover from this injury. And obviously, with you describing about the injury itself, I can understand why it takes so long. But what are the different phases of recovering from an ACL injury? Why does it take so long to get back to your baseline, if you do get back to your baseline?
So the way you have to think about this is, even though it's not a broken bone, you have to think about it like the knee is broken, essentially. It's not functioning correctly because a ligament has been torn off of the bone. So the surgery reattaches the ligament to the bone, or uses a cadaver ligament, and sometimes uses the patient's own muscle to create a new ligament. Regardless of what type of surgery is done, that new ligament then has to reattach to both bones, the femur and the tibia. And it takes the body that long to heal. So if you were to break your arm or your ankle, it would take that bone 10 to 12 weeks to heal. That's just the normal healing time. Yeah. And then once it's healed, after that, 3-month healing process, then it has to get strong again. So first you have to let it heal, reattach, become stable. And then you have to make it strong again so it doesn't happen again. So that's why it takes long, because first you have to go through the healing phase, and then you have to go through the physical therapy to strengthen the muscles around the ligament and also to strengthen the ligament itself. So, and it is shown that if players go back too soon, if they go back before 6 or 7 months, the risk of re-injuring is exponentially high.
Wow, that's incredible. I mean, I think somebody had told me, a fan had told me, I think it was, that Vivian Miedemar, she had to have 3 surgeries on her ACL or something like that. I'm guessing that's not normal.
That's not normal, and I don't know the circumstances behind her injury, so I'm not going to speak on it. But every injury is different, and sometimes it's not just the ACL that is torn. Sometimes it's a meniscus tear. There's ligaments on the outside and inside of the knee that can be torn. So even though it's called an ACL ligament tear, there might be other ligaments or the meniscus inside the knee that has to be repaired as well. And sometimes that can make the recovery even longer. So it depends on the degree of injury too.
Okay.
Yeah. Now, and that being said, I'm not an orthopedic surgeon, so I don't fix these. My job is to prevent them from happening. So So when they do happen, we have an orthopedic team in our office. My dad's actually an orthopedic surgeon, so he would be the one to do the surgery, and then the patient would then go on to our physical therapist for the recovery
Wow.
phase. But yeah, so we have a whole setup, but yeah, and that's good. So teamwork is good. But my role in our practice and in the females football sports medicine is to educate players and parents on ways to help prevent this from happening. And if it does happen, then educate them on how to prevent it from happening again, because it can.
So in addition to what we've already spoken about in terms of, prevention and, the dietary and the period tracking and everything like that, what other advice and what other education do you give to the athletes or to parents to help to prevent the injury from occurring in the first place? And is there any data to support the advice at the moment?
Right. So one big thing is playing surfaces. And in America, a lot of our athletes play on turf fields. I know in England it's more grass, which is good. That's ideal. There is data that shows that turf will increase injury of lower extremities for both the men and women.
Mm-hmm.
However, women have increased injury rate on turf than men. There's a recent article done on that, and I can send that to you if you'd like. Yeah, I have all types of articles that I can send you.
But why turf? What's the difference between turf and grass that turf is creating more opportunities for injury?
So the cleats tend to get stuck in the turf more so than grass.
Mm-hmm.
So what happens is one of the more common ways to tear the ACL is what we call plant and turn injury. Mm-hmm. It's where the foot gets stuck and the leg turns. Mm-hmm. And that's non-contact. So the player doesn't have contact with anyone else. They're running down the field. They want to turn direction. They plant their foot to turn and the leg turns, but the foot gets actually stuck in. So the foot stays and the leg turns, and then the torque goes on that knee ligament and the ACL tears. So turf is much easier to get stuck in. And another big problem with turf and grass are the shoes and the stud length. Mm-hmm. So there are different stud lengths for different playing surfaces. Most professional players know this. A lot of amateur players do not know this. And this is something I really harp on with my education, is always look at your studs, because you never want to have a bladed stud on a turf field. If that stud is too long, if it's bladed, it's much more likely to get stuck in the turf, which will greatly increase the injury rate. Not only ACL, also ankle sprains, other types of injuries of the lower extremity. So that's why turf and grass are so different. It's the idea that cleat can get stuck in the turf much easier than it does in the grass. The cleat tends to slide more on grass than it does on turf.
Is there an optimum, is there a middle ground in terms of how long the length should be of the cleat? So it's kind of like, a level playing field, pardon the pun, to prevent the injury. Like, is there an optimum length?
So there are all different types of cleats for soccer boots. There's the long bladed cleat, which you only want on grass or muddy ground. And then a turf or artificial grass cleat is more of a conical stud, so it's short and round. And they also have what's called MG, which are multi-ground cleats, which is what you're talking about. And most of them are short and conical, and I think they have one or two longer cleats in those shoes. So you have to look at the shoe that you're buying. There's for hard ground, which is, I think, HG, and then artificial turf, and then multi-ground. Mm-hmm. So those are the three. And then in the indoor shoes, which are pretty much flat. Mm-hmm. So it's really important for players to identify their playing pitch and then make sure they have the appropriate cleat length for that pitch, because that will greatly help to reduce the injury risk.
And what about the placement of where the cleats actually are? Because I know, say, for example, Nike had brought out the Nike Phantoms, and the Nike, is it Cyclone, I think it was, and they've got like the circular pattern
right
of the boot. How does that affect it?
So there's a difference between men and women as to how our feet are. Women have a wider like toe box, so our metatarsals are a little bit wider than men, and cleats can be placed differently for women versus men on the shoe because of different pressure points. So some of the companies that are now making women shoes are doing a different cleat pattern because of that. The Phantom Luna, which I think you're talking about with the circular pattern, yeah, they just came out with that specifically for women, which is great, that there's a woman's shoe like that on the market. And I have not talked to Nike. I haven't talked to their designer, so I don't know the exact idea behind the circular pattern. But to me, it looks like it's made so that the foot will slide more in that motion. So like when the foot gets planted and turns, those, if you look at the bottom of the cleat, they're all in one direction so that it slides with the leg. As far as placement's concerned, I think it depends on different pressure points. I've also worked with Ida, which is another really great shoe company, and they only make women's boots, and they place their cleats in different locations based on female anatomy to decrease pressure. So that has a lot to do with it as well.
Wow, that's so interesting. It kind of just blows my mind a little bit how these little cleats, these little studs on the bottom of the shoe can actually have such a big impact. I mean, I remember when I used to play football, the boots at the bottom, they just used to be like metal studs. That's
right.
it. And that was it. You just played on that. To be fair though, I did get a lot of ankle injuries. A lot.
Right, yeah.
A very weak ankle actually because of
and those studs probably got caught in because those were not good studs. So that might be part of it. And the other thing which is interesting about the shoes is with women, as we talked, we turn in more. So we pronate a little more, which means we put more pressure on the inside of our feet and our legs because of our anatomy. So women's shoes should be made with a bit of an arch support to take pressure off the inside of the leg and the knee. And that would also help to decrease that injury rate. And I know that some shoe companies are doing that now, but there aren't a lot of women specific soccer boots out there. Most shoes on the market are made for men and then sold in women's sizes. So there are very few shoes that are made for female anatomy, and that definitely has to change. And I think if we had more shoes made for female anatomy, that would definitely help to decrease some of the injury rate.
Really interesting. I did read that for the Women's World Cup in Australia, there was a specific company that was making women only boots. Is that the company that you're?
Yeah, so that's Ida. Yeah,
that's
it's a great company, and they make female specific boots. They do it from a last made from, you know, a female athlete. They have studied the anatomy. The studs are placed in the right position. They have a little bit of an arch support in their shoe. So they're doing all of the right things, which is great. And hopefully more shoe companies follow their suit and make boots for us, because why not?
Well, yeah, exactly.
Yeah.
Companies are a bit late to the game, I suppose. And I think
Right.
there's such a massive opportunity here, whether they look at it financially or for the progress of the game. You can't lose, can you? So
No.
it just does need to happen.
Right.
The other part that I'm quite interested in is actually about movement. So you talked about strength and conditioning, and you spoke a little bit about the movement, and you mentioned things like landing and that sort of thing. What I want to know is, and I've asked the likes of Karen Bardsley about this. So she's the ex Lioness goalkeeper.
Okay.
Bumped into her at a conference, and I had this question. I was like, do you know what? I've not heard of a goalkeeper, for example, who has like ruptured their ACL, and she said that her friend had, but that's because she had moved incorrectly. But obviously goalkeepers don't move as much as the players on the field do,
Right.
but they still have the whole jumping, landing. They have more exaggerated movements, obviously, in order to save the goal. So do you think there is a difference in the way goalkeepers are trained to land and use their movements as opposed to the on-field players who are running around and have a range of movements?
I would say yes. I am not a strength and conditioning coach. I don't, do these type of activities with athletes. But if you look at a goalkeeper, most of them stand with their knees bent. They're a little bit like crouched down at most times, not a lot, but enough to really stabilize that knee, and their hamstrings and quadriceps are fully engaged. I would say 90% of the time. Whereas a field player, they're running and they're moving in different directions. Like you said, there's much more movement and a quick change of direction. Whereas the goalkeepers don't change direction like that. They change direction, but not like to turn around in a quick motion. Okay, I mean, everyone does that, I guess, occasionally, but it's less often.
Mm.
So, but I also think probably their strength and conditioning is different. They probably work more on those jumps and landings because they're always coming down with the ball and coming, down off of a leap or a jump. So, and again, I don't work with goalkeepers. I'm not sure of this, but that's what I would assume. When you just look at the way they stand and their stance, and they seem to be more muscular than players on the field.
It is quite interesting. I remember watching an interview with Rachel Yankee, and she was saying that when she had moved clubs, the new club which she was at, which I can't remember which one it was, but she was saying that was the first club that actually taught her how to land properly. And she felt like as if by learning how to land properly, it actually helped her like become more grounded and actually prevent injuries from occurring. So
Right.
Clearly it doesn't appear to happen in general across the board.
Right. And so that's the other thing that I speak about is we need to be teaching our young girls how to land when they first start playing football or soccer. We can't, it's really hard to teach someone when they're 17, 20, 23 years old how to land. When they're advanced in their career, they're, superstars, and all of a sudden you're going to change their landing, So that's something we have to teach them when they're young. And then they don't have to think about it. It's like learning how to walk. You teach them how to land when they're first starting to play the game. Then it becomes innate and they don't have to think about it. Whereas if you try and teach an adult football or soccer player how to land, yeah, sure, they'll do it, but they'll probably have to think about it more and it won't be as natural. So I think that's a big deal to start young with a lot of these things, with proprioception, landing, and even some of the strength and conditioning programs.
Do you think there's a way to predict the risk of getting an ACL injury? And I mention this because I was having a chat with one of our GPs, and I was explaining to him about this, this ACL injury problem that we've got. And we were having a bit of a brainstorm. Now, when we're talking about cardiovascular disease, we use something called a Q-risk-3, which is a predictor tool to figure out what is the probability of getting a heart attack or a stroke within the next 10 years. I mean, it includes lots of different risk factors and that sort of thing that the patient may have. And that got us thinking, and we're like, oh, could we potentially, if we're able to identify the plethora of risk factors, is there a way to create a predictability tool that would allow clubs to actually, for each individual player, to ascertain what the risk of getting an ACL injury is, and then to put a plan in place? Or is it completely redundant because we know what we need to do, we just need to do it?
So I think step one is to gather data on these factors that we think increase the risk of ACL injury. And then if we can find out what does, like whether it's neuromuscular, hormonal, whether it's anatomy, shoe gear, once we like narrow it down and say, okay, it's these three things that really increase our risk, I think then you could go back and do a predictability score. But I don't think we can do that without, the first big movement, which is figure out why this is happening and take all these factors that we're talking about and really get a lot of participants to narrow it down. And I think once you do that, then yeah, I think you probably could, if you could figure out precisely what the factors are. Does that make sense? Just
Yeah.
like in the heart, right?
Yeah, it's such a
Yeah.
massive piece of work, and
Hmm.
you're right. It's because we just don't have we don't have the
The data.
concise and succinct data
Yeah.
to be able to identify all of the risk factors. I think people have been looking at these things individually, but like the factors individually, but there hasn't been, again, as I say, like as you know, a collaborative approach to this. We have looked at a couple of things separately, but it's not robust enough.
Hmm.
Is my thought. So where do you think, now we've talked a little bit about this actually in quite some detail, but we know that there are gaps in research. What is the biggest gap in the research at the moment? Like, where do we start? Because it feels like as if it's a bit of a minefield. Do we start with the hormones? Do we start with the strength and conditioning? Do we start with the boots? Where do we start?
So I think you could do it two ways. I mean, one option would be to take each thing individually and study it. But you need much more data. We can't have a little study of 20 or 100 participants. Like ideally you would need 1,000 participants in order to get some good results, some good data. In my ideal world, I would like to take all of these things and do a study looking at everything. Because then we could compare and contrast, if you can look at the player's both internal and external environment when the injury occurs, that would be our best point of data. So if you can say someone tears their ACL, they're playing on turf, they're in shoes with bladed cleats, they're on phase 2 or phase 3 of their menstrual cycle, and they do strength and conditioning programs, but it's sporadic, not all the time. So you have you're looking at all of those things, those 5 things. And then if you have enough players where you can capture the internal, external environment, and then we can narrow it down into like one common denominator, essentially.
Is there a way do you think that we could use AI to sort of help with the analysis of like player movements, looking at like the difference in pressures and the difference in the movement and stuff like that? Do you think that is something that could be used to gather that kind of data as well?
Oh, absolutely. And I think a lot of, like the big teams are doing that. They have labs, biomechanic labs, where they, you get on a treadmill, you have put on all the devices, and they can measure your stride length, they can measure your pressure points on your lower extremity when you're running, when you're jumping, all of those things. And then, same with the hormones, they can measure the hormone levels through blood samples. That's right up your alley. But, just to see where the hormones are at during the player's a month cycle. And there are very intricate medical things that we can do to help really track all of this. And then the strength and conditioning, and I think that's kind of all over the board because there's so many different strength and conditioning coaches for different programs. So I think I'm not a physiotherapist, but I feel that there should be maybe 1 or 2 programs that all the athletes are taking part of that focus more on female anatomy, instead of it being very haphazard. And again, I can't speak for the professional leagues because I'm quite sure they're doing a lot of this already. But, as we go down into clubs and in high school and college, a lot of that's still all over the place. And that's where we see a lot of it too. I mean, my daughter's friend is on a team. They had 3 people tear their ACL this season for their high school team. So it's not just the pros. The pros are the ones that we're talking about because they're our girls' heroes and they're important, but it's happening to young teenage soccer players too.
Considering that it happens to young teenage soccer players as well, I mean, at that age they're still growing, right? I mean, at what age does this ligament stop growing at a particular age or something like that? Like, we talked about, oh yeah, strength and conditioning needs to happen earlier. What kind of impact does that actually have on the ACL itself? Like, how does it, how does it grow? Like, I'm just trying to think, because obviously once you hit a certain age, you stop growing, right?
Right. And all kids are different. So, we have some kids who are done growing at 15 and some kids who don't stop growing until they're 22. It depends. They're really all different, and I see it in my office every day. But what is interesting is we really don't see this injury in kids. So if you really start to think about it, this is a post-puberty problem, which makes me kind of leads you down that hormone route again a little bit, because it's really unlikely to see an ACL injury in a youth soccer player,
well,
boy or girl.
Interesting, isn't it? God, that opens up a whole other area of research.
Yeah. I know, but then it's your mind starts to explode when you really start to think about it.
It really does. I'm an ideas person, so
but it's usually it's usually adolescence and older is what we see this in. And I mean, it's not just hormones. They're growing during that phase. Developing, the muscles are different, as they get older, they become stronger in different areas. And for girls, their limbs develop, their hips might get a little bit wider. So all those things that we talked about, it's not just the hormones, it's also anatomy too.
Do we know what happens like after you've had a baby? Like, obviously, because the hormones change again once you've had a baby, or postmenopausal or anything like that. Do we have any information or data on rates of ACL injury, after having a baby, or
I don't particularly, but I'm sure I've heard people talk about that, and so it might be out there. That's interesting, and I'll look into that. But that would be an interesting study as well.
Yeah, I think there really does need to be a lot of work about the female.
See, all these things we're talking about, we need data on.
Oh my God, we need
so important, so important. And I'm just one person. Like I have ideas. I've been, looking into this for over 10, 15 years. So I think, like you said, it really needs to be a collective effort to really try and figure this out.
So if any clubs are out there listening, any physiotherapists out there who are listening, anybody who's interested in the female athlete, and anybody who's in the research and development side of things, get in touch with Dr. Karli Richards, because she's your woman. This happened, yeah.
And to be fair, I've spoken at a lot of international conferences, and there are a lot of people who are very interested in this. So the interest is there, and we're slowly starting to make some things happen. The word is slowly, but I like you said, I have high hopes that I think we're going to start to really move forward with this soon.
I just want to go back to a point that you said about strength and conditioning. And you said that at the higher level, strength and conditioning is happening, is being kind of implemented. And do we have any of that data yet? Because if they're doing all these changes and stuff with diet, nutrition, strength and conditioning, do we have any of that data yet to suggest that it is preventing ACL injuries?
I'd have to look into that. There are new studies published every day, so I'll have to look into that. I don't have a direct answer for you, but I do know that they are starting to focus more on female specific programs, which is good. And what has happened in the past, that they've taken male strength and conditioning coaches and just put them with the women's team and train them in the same way. And so that's what has to really change, is our neuromuscular makeup is different, so the training has to be different.
We need this at university level, don't we? Like when they were strength and conditioning courses, and in university, it needs to be the curriculum needs to change, isn't it? There needs to be a change in the curriculum so that we do have a whole module on the female athlete, ideally.
Right, and this is happening on the pro level as well. One of my good friends, and I'm not going to mention her name, she played for a professional team in Europe and ended up tearing her ACL on a really bad turf field. It was a plant and turn injury, but also she told me that the strength and conditioning program that her particular club had was not great. So, and again, this wasn't, top of the line. It wasn't, the Lionesses or the U.S. Women's National Team, but there's still a pro level in Europe. And so they're not getting all the resources that they need either. So it's on many levels. And a lot of it is equality for the women athletes.
Wow. So, I mean, takeaway messages from today is that ACL injuries is multifactorial. We need more research, which everybody is saying, but actually we need investment in the research to happen. So you can't just talk about it. We need to actually do it. And we need people to invest in this so that we can make it happen and make sure we've got the sustainability of the women's game and to help to prevent these ACL injuries so that we've got a better understanding and actually tailor training programs for the female athlete, which is not 100% happening across the board.
Right. And I have a research proposal, which I have written that it incorporates a lot of what we talked about. And so at this point, I'm looking for stakeholders and investors and people to push it forward. So if anyone really is interested and wants to try and make this better, I'd be happy to talk to you. So there's a lot of people who are interested. Yes, we need to be invested.
True. I have some ideas to make that happen, but we can definitely do it. Dr. Karli Richards, I just want to say thank you so much for coming.
Thank you.
The kickback. It's been such a pleasure to have you here. It's been great to talk about ACL injuries and women's health and actually have so many ideas. And I think we'll be staying connected because there's a lot of work that we need to do.
Absolutely. Yeah. Yes, thank you.
Excellent. Thank you so much. Is there any kind of last messages that you want to say to our listeners and our viewers?
So I can give you a few take-home tools, if that's helpful. So one website is origo.com, and they have a lot of information on period tracking and nutrition on that. And another app is called Fitter Woman. It's FITTR Woman. And that is an app where you can actually do period tracking, and it will give you nutrition guidelines during different phases of your cycle and different strength and conditioning programs that you should be doing during different phases. So that's very helpful. And the two shoes that are on the market right now that I would recommend are Ida, the Ida soccer boot for women, and then the new Nike Phantom Luna. I've checked both of those out, and those are very well made. So, and I think that's pretty much it. But strength and conditioning is important, and just education, so you understand your anatomy, your physiology, and what makes you work and what can make you stronger to help prevent injury in the future.
Excellent. Thank you so much, and I will post those links also in the comments and everything as well, so everybody's got access to that. Because we have a few fans who are like our young athletes, so they'll definitely be interested in this. And because I know quite a few of our young fans, they actually stopped doing sports because of the rate of injuries that they were getting. So actually, everything that you've mentioned, I know, so everything
that makes me sad.
Me too.
It really does. Don't stop.
So everything that you mentioned, I'll mention it to them as well, and I'll send them this podcast and your advice, and I know that they will just absorb like a sponge everything that you said. And the more people we have talking about this, the more support we have, the more that we will make this happen. So watch this space, everybody. We are going to prevent ACL injuries. That is a pledge. I pledge to prevent ACL injuries.
Do our best to prevent them.
We'll do our best to prevent them. Excellent. Thank you so much, everybody, for listening. Thank you, Dr. Karli Richards. You've been absolutely amazing. It's been such a pleasure.
Thank you.
Thank you.